California hospitals are on the brink of financial disaster. The state legislature is swooping in, but is this a problem of their own making? Welcome to America Uncovered. I'm Chris Chappell. The U.S. hospital system is in a crisis. 2022 was hospitals' worst financial year in decades, and it looks like 2023 isn't going to be much better. The situation is particularly dire for rural hospitals. According to a report from the Center for Healthcare Quality and Payment Reform, more than 600 rural hospitals, nearly 30% of all rural hospitals in the country, are at risk of closing. The situation is particularly dire in California, because of course it is. So the state is stepping in. Failing California hospitals are about to get an emergency bailout. So how bad is the situation in California? According to a recent Kaufman Hall report commissioned by the California Hospital Association, 1 in 5 hospitals in California are at risk of closure. Meanwhile, 30% of California's rural hospitals are at risk of closing, and half of them have already removed services to reduce cost. Some are eliminating their home health services. Staff are being laid off to save money. Even maternity wards are being closed. This hospital filed for bankruptcy as they cut maternity, pediatric, and outpatient radiology services to save cash. All that sounds pretty bad, and it is, but it wasn't until a hospital actually failed that the California legislature took notice. In January of this year, Madera Hospital, the only hospital in Madera County, closed, leaving a community of nearly 160,000 people with no medical center within a 30-minute drive. That's a life or death difference in travel time. But that's just one reason the loss of rural hospitals is a big deal. According to the Center for Healthcare Quality and Payment Reform, in many small rural communities, the hospital is the only place where residents can get laboratory tests or imaging studies, and it may be the only or principal source of primary care in the community. So when Madera Hospital closed and reports started coming in that other hospitals were on the brink, California lawmakers began to panic. In response, they approved an emergency loan program law in May, before the usual time they approve budgets in June. The law established the Distressed Hospital Loan Program. It would offer interest-free cash loans to eligible nonprofit and public hospitals over the next couple of years. The pot for the program is $150 million. Once a hospital is granted a loan, it will have to begin making monthly repayments after the first 18 months. Hospitals will be required to discharge the loan within 72 months of the loan being given. The thing is, for hospitals, $150 million is just a drop in the bucket, and the California lawmakers know that. California Assemblywoman Esmeralda Soria said that the loan is just a short-term solution and that it's meant to incentivize a potential operating partner who would shoulder the total costs and responsibilities of a reopening process. So how did California's hospitals get into this state? I'll tell you after the break. Welcome back. 1 in 5 hospitals in California is at risk of closing. But why? Well, a lot of it is thanks to growing operating costs, which are outpacing revenue. In 2019, California hospitals had an operating margin of 5.2%, which basically means that their revenue was 5.2% above their expenses. In 2022, the operating margin was negative 1.6%. That represents a loss of $8.5 billion compared to 2019. And that's in addition to the $12.1 billion in losses for 2020 and 2021. California hospitals are hemorrhaging money, and a lot of that is going into labor costs. You see, in the years following the start of the pandemic, salaries and benefits increased by $12 billion. A nationwide nurse shortage is making it even worse. There's been a nurse shortage for decades, but things really got bad during COVID, thanks to high burnout rates. Since the start of the pandemic, hospitals have lost a total of 105,000 employees, and nursing vacancies have more than doubled. According to consulting firm McKinsey, by 2025, the U.S. may have a gap of up to 450,000 nurses for direct patient care. Meeting demand would require more than double the current number of nursing graduates every year for the next 3 years straight. That likely ain't happening. Good thing all those nurses were fired for not taking the COVID vaccine. Now, you'd think that with fewer nurses, hospitals would be spending less on salaries, but it's actually the complete opposite. Fewer nurses means more overtime, and nurses who can demand higher salaries. On top of that, hospitals need to rely on expensive contract nurses to fill in the gaps. In California, contract nurses are costing $3.8 billion more than they did in 2019. Hospitals have to pay even more in rural areas, since people there tend to be older, sicker, and poorer, and the area isn't as attractive for potential staff as cities. Without enough nurses, hospitals are left with less nursing experience, less patient monitoring, and more medical mistakes. In addition to increased labor costs, inflation and supply chain shortages are impacting hospital expenses, just like they are doing to everything else. But increased labor and supply expenses are happening everywhere in the United States. California has a hospital revenue problem that is uniquely California, and that is the state's commercial health plan. 1 in 3 Californians are enrolled in California's Medicaid program called medi-cal. The number of people enrolled in medi-cal drastically increased during the pandemic thanks to Democrats expanding eligibility to make all low-income adults over 50 eligible for medi-cal, even if they're illegal immigrants. California wasn't finished. It recently expanded medi-cal again to cover all low-income adults over 26, regardless of immigration status. All low-income adults 25 and younger were already covered. That expansion won't go into effect until January 2024, which is coming a lot sooner than you might think. So there are a lot of people enrolled in medi-cal, but medi-cal is not overly kind to hospitals. According to the LA Times, while more people are on medi-cal, how much medi-cal pays hospitals has stayed the same. Medi-cal tends to pay providers less than what private insurance pays, especially since California froze its reimbursement rates in 2012. According to the president of the California Hospital Association, on average, for every dollar a hospital spends to care for someone, Medi-cal reimburses it 74 cents. Many of the medical centers that are struggling the most are ones where a majority of patients are on Medi-cal or Medicare. With higher supply and labor costs, fewer nurses, and more patients on Medi-cal, California hospitals are in a doom spiral that's leading to worse health care services. As a result, patients are suffering from increasing waits from hospital transfers, or hospital closures that leave them 30 minutes from any kind of health care. So, aside from the $150 million loan, what else is California doing to address this pressing matter? California is considering other bills, such as one that would require California's Department of Health Care Access and Administration to provide grant funding to small and rural hospitals specifically. It's also considering a bill that would reinstate a tax on managed care organizations, private companies that administer the Medi-cal program. The last time it was in place, it saved the state $1.5 billion. It expired in 2020, but California Governor Gavin Newsom and some lawmakers are interested in bringing the tax back. The Newsom administration says it plans to use some of that new tax money to increase payments to hospitals for Medi-cal patients. But those increases wouldn't happen until next year at the earliest. Lawmakers also pledged to offer more money this month when the state budget is finished. Now, many in the health industry have long been frustrated that California hasn't done enough to address their needs, especially after Californian politicians celebrated a $100 billion budget surplus last year. So it makes sense that the California Hospital Association asked for a one-time payment of $1.5 billion. But it's hard to say how exactly California will be able to pay since it has a $22.5 billion deficit. On top of that, California is moving to increase the minimum wage for healthcare workers, which means even more expenses to offset. And even worse, many California residents are at risk of heart attacks if a California panel's recommendation to pay black residents $800 billion in reparations goes through. Socialism at its finest. So what do you think of California's hospital crisis? Leave your comments below. And remember that we rely mainly on direct support from viewers like you. If you want to help us deliver nonpartisan news, all it takes is as little as $1 per episode over on our crowdfunding website, Patreon. Visit patreon.com/America Uncovered for more. Click the link below. Once again, I'm Chris Chappell, and you're watching America Uncovered.